Okay, I think I am live here. I am just testing this feature. Where to type? How to respond to comments? Okay. Is anyone able to see me? So those who have joined, this is just I'm testing this live feature which has come up on YouTube. Okay, how? Very nice. So now I can see you all are here. Just give me a welcome to all. I'm just testing this. Thank you, Rohit, Kalpesh, Vikas, Konsar, RS Nirvana, Umang. Uh, I can read it. So I'm just testing out this live stream so that I can use it to share the daily cases, the daily good things which we learn or see on day-to-day basis, because it doesn't take time and we can just join it. So those who are listening, just give me feedback how the voice is coming on this live chat. I've connected a mic, whether it's um, coming nice or not. Okay, so I'm clear. Thank you, Bipin. You have sent perfect voice. Oh, nice. So those who are listening, I will be using this live chat feature on YouTube to share my daily experiences or the things which we see in the ICU. So want to thank you, Snow, for your feedback. So the today's case was, I want to share a trauma case. This young fellow was driving on his bike and then got hit by some divider or something, we don't know exactly, but what happened that when we then he got intubated outside and then he came to us, and surprisingly what was the injury, that this patient has a carotid dissection. He was holding, I think, phone like this, maybe we can assume, and he fell on the ground and there was a carotid dissection. So just like you have seen aortic dissection, it was a carotid dissection. So what happened, as soon as the dissection happened, the blood spilled out from the carotid artery, and there was a massive traumatic subarachnoid hemorrhage. So it was not an aneurysmal bleed, there was a massive subarachnoid hemorrhage, and as soon as the dissection happened, first the blood spill out in the subarachnoid space, and then what happened, then there because of that thrombus which was found in the carotid, there was a full carotid block, the flow was obstructed. So at the same time you had a massive subarachnoid hemorrhage, and followed by which there is a carotid block, so there was no flow into the carotid artery at the same time. Other than that, he had a long bone fracture, so had fat embolism. Also, that fat embolism gone to the brain also. So in the falx cerebri, we were able to see the fat. So whenever you see a fat embolism in the scan, it will not be pure gray. It will be somewhat in near opacity to air. I will show the scan of that patient if I get the time. And then on the long bone fracture side, this fellow also had a popliteal vein thrombosis, which was a traumatic DVT. So in the same patient, you have a carotid dissection, you have a subarachnoid hemorrhage, followed by infarct because of the blockade of the carotid artery, and then there is a traumatic long bone fracture with fat embolism, and then a popliteal vein thrombus. So these were the things. So okay, from Somalia. So this was the case. So now after 48 hours, what we'll do, we'll try to see the neurology, we'll try to do tracheostomy, and then the question is when to start the low molecular weight or heparin, so that for DVT and also for the carotid artery to restore the flow. We did a repeat CT scan, and the infarct size is not so much. He started receiving a flow from the opposite side because of the collaterals. So this was, so the crux of this case was go and read and find out how carotid artery dissection presents. This is important. Carotid artery dissection also happens whenever somebody goes to the barber or somewhere else and they do it very massage like this. They twist the neck, something like this, and in that you have carotid neck dissection, which is very, very common. So go and read what is carotid artery dissection and how it presents, how the what is the management of it. So just want to share this key. In a single patient you have carotid artery dissection followed by subarachnoid hemorrhage, followed by infarct in that particular area with fat embolism, long bone fracture, and with popliteal vein thrombosis. So these are the things. Also, yes, so I think we will be successfully able to manage this patient. We'll try our best. So the idea was that with this vertical live feed, vertical live feature on YouTube, at the end of the day we can have 5-10 minutes in which we can share different cases and we can learn. Also, there was a patient today who had a code blue announced in the hospital and it was revived and shifted back. There was no obvious cause we were able to find out, but when we did an ECG, ECG was bang normal except for the long QT. So this patient may had VTVF phenomena. So this patient was having in the baseline hypokalemia, hypocalcemia. So this could have caused prolonged QT interval, and because of that, this patient may had VTVF. So, this was something I wanted to share with you. Also, I wanted to share how my voice is coming like this. So now I will go through your comments so that I can see what people have asked. Okay, because thank you and for this happy Basant Panchami and Saraswati Puja. You can see I have wear this yellow one on this day, like that. So those who are listening, Saraswati Puja means the worship of the goddess of knowledge. And Nirvana, namaste from Nepal. Thank you so much. Amiodarone dilution, okay, we'll share these cases. So I hope, okay, emergency drug and doses. Okay. Tracheostomy we will do tomorrow, or we are in planning if the neurology comes out over this case. So just wanted to know whether you people like this live feed, smart live feed every day. I'm trying. I will try to go live couple of minutes, 5 to 6 minutes daily on basis, so that I can share some cases with you. Hope it helps. Do again give me your feedback regarding the voice, because I can record from anywhere, so that at least if my face is not coming clear or the background is not clear, but the voice should be clear, I think. Okay. For Somali doctors, you can have the email on our ESBICM website. You can connect by them. My email is there. You can get connected with them. This is much requested video. Zoso will try to do it. Emergency drug doses and infusion method. Okay. So again, thank you, and do post feedback regarding the voice in this live stream. And I will try to connect daily basis for a couple of minutes daily, and will share some cases on daily basis. So thank you, and see you tomorrow. Good night. I don't know how to end this. Thank you, Krishna, for giving feedback. Bye bye.